Hello everyone, I welcome you back to this 8 episodes of Target Nursing Officer exam. Question number 1. Asthma is option A caused by virus, option B caused by fungus, option C caused by bacterium, option D none of the above. Asthma is the chronic disease of airways or characterized by inflammation and narrowing of airways. Asthma is a chronic disease characterized by inflammation and narrowing of airways, and it is triggered by dust or pollens, etc. So the correct option here is option D, which is none of the above. Question number 2. Asthma causes option A dilation and inflammation of the airways in the lungs, option B constriction and inflammation of the airways of the lungs, option C inflammation of the lungs, option D dilation of airways. Correct option here is option B, which is constriction and inflammation of airways of the lungs. Constriction also means narrowing of airways. Question number 3. Pulmonary embolism is option A an infectious disease, option B medical emergency, option C type of cancer, option D an autoimmune disease. Correct option here is option B, which is a medical emergency. Pulmonary embolism is the third most common cause of death after myocardial infarction and cerebrovascular accidents. And what happened in this pulmonary embolism? The thrombus or thrombi which present in the deep veins gets detached and mobilized into the pulmonary circulations, and after reaching the pulmonary circulation it gets attached or occlude this pulmonary circulation, thereby impair the gas exchange and circulation, and eventually leads to patient death. Question number 4. D-dimer fibrin is option A type of X-ray, option B type of endoscopic examination, option C a blood test used to rule out blood clot, option D a blood test used to identify inflammation. Correct option here is option C, which is a type of D-dimer is a blood test to rule out blood clot. Question number 5. Troponin is option A cardiac enzyme, option B bacterium, option C fungus, option D a type of X-ray. Correct option here is option A, which is cardiac enzyme. Question number 6. Pneumonia is option A type of cancer, option B another name for bronchitis, option C a form of hepatitis, option D a lung infections. Pneumonia is the inflammation of the alveoli or the surrounding tissues, and it is the type of lung infection. The correct option here is option D. Question number 7. The nurse needs to carefully assess the complaints of pain in the elderly because old people are option A have a decreased pain threshold, option B have altered mental function, option C are expected to experience chronic pain, option D experience reduced sensory perception. Here the question given that the nurse needs to carefully assess the complaints of elderly, which is complaint of pain, and she should assess carefully because in case of elderly there is degenerative changes, and this leads to reduce sensitivity to touch or reduce acuity to touch or alteration of the neural pathway and that leads to diminished process of sensory or diminished sensory response. So the correct option here is option D, which is experience reduced sensory perception. Question number 8. A construction worker of 56 years old is brought to hospital after falling from the building. The nurse should be most concerned if the assessment reveal option A, a depressed fontanelle, option B, bleeding from ears, option C, an elevated temperature, option D, reactive pupils. Here in question number 8, the case is given that the 50 years old worker was brought to hospital after falling from the building. So the nurse should be more concerned if her assessment revealed that the patient has bleeding from ears. Correct option is B, bleeding from ears. Why? Because bleeding from ears occurs only if there is basal skull fracture that will contribute to increased intracranial pressure and may cause brain hernia also. So the nurse should assess the patient thoroughly for any alteration in the cerebral functions or increased cranial pressure or to find fracture or bleeding from patient ears. Question number 9. A client who is having Pheochromocytoma complains of sweating, palpitation and headache. Which assessment is essential for nurse to make first? Option given: option A, pupil reaction, option B, hand grip, option C, blood glucose, option D, blood pressure. So what is this Pheochromocytoma? It is a tumor of adrenal medulla, and this tumor leads to the increased secretion of catecholamines, and that leads to elevation of BP or increase in BP. So the correct option here is option D, which is blood pressure. Question number 10. Which of the following would be inappropriate to include in a diabetic teaching plan? Option A, change position early to increase circulation. Option B, inspect feet and legs daily for any changes. Option C, keep the legs elevated on 2 pillows while sleeping. Option D, keep the insulin not in use in the refrigerator. So the correct option here is option C, which is keep the legs elevated on 2 pillows while sleeping. Why? Because a patient with diabetes mellitus or diabetic patient, they have decreased peripheral circulation caused by microangiopathy. So keeping the legs elevated will further cause this circulation impairment. So the option C should not be included in the teaching plan for diabetic patient. Question number 11. Valsalva maneuver can result in bradycardia. Which of the following activities will not stimulate Valsalva maneuver? Option A, use of stool softener. Option B, enema administration. Option C, caking while toothbrushing. Option D, lifting heavy objects. And what is this Valsalva maneuver? It is the force expression against closed clothes. So what happened here? It's activities like straining defecation, like blowing a balloon, etc. can lead to this buccal stimulation, and that will lead to bradycardia. So use of stool softener will prevent or will help in easy evacuation of bowel, that will prevent straining during defecation. So the correct option here is option A, which is use of stool softener. Question number 12. After Bill Roth surgery, the client developed dumping syndrome. Which of the following should the nurse exclude in the plan of care? Option A, sit upright for at least 30 minutes after meal. Option B, take only sips of water between bits or between the solid foods. Option C, eat small meals every 2 to 3 hours. Option D, reduce the amount of simple carbohydrates in the diet. Correct option here is option A. Sit upright for at least 30 minutes after meal should be excluded in the plan of care of the patient. Question number 13. What is the best reason for the nurse in instructing the client to rotate injection sites for insulin? Option A. Lipodystrophy can result in extremely painful. Option B. Poor rotation technique can cause superficial hemorrhage. Option C. Area can result in lipodystrophy, causing erratic insulin absorption rate. Option D. Injection sites can never be reused. Correct option here is option C, which is area can result in lipodystrophy, which can cause erratic insulin absorptions, and this lipodystrophy is the fibrofatty mass that happen at the injection sites due to repeated use of same area, and this lipodystrophy can lead to poor absorption of insulin. Question number 14. What instruction should the client be given before undergoing abdominal paracentesis or ascitic tapping? Option A, NPO 12 hours before the procedure. Option B, empty bladder before the procedure. Option C, strict bed rest following procedure. Option D, empty bowel before procedure. Correct option here is option B, which is empty bladder before procedure, in order to prevent injury to the bladder or to the bladder which is full.